Greetings, sisters and brothers, friends. Welcome to the Toronto and York Region Labour Council's Day of Mourning ceremony. My name is John Cartwright, President of the Labour Council. You know, this has been a very tough year across the world. Thousands have lost their lives. Millions more have been touched by the COVID-19. Today you'll hear speakers talking about the experience of frontline workers, whether they're in healthcare, providing food or essential services, or those who risk themselves on a day-to-day basis. It's been 60 years since the Hogs Hollow tragedy sent shockwaves through Torontonians because of the senseless loss of lives in construction. Those losses continue today. We ask everybody, as we go about our day-to-day work, that you practice social distancing that our health professionals are telling us is so important. But most importantly, we ask you to be safe and remember those who've come before us. Thank you for joining us.
Greetings. My name is Jackie Walker, and I'm the Nursing Division President at SEIU Healthcare, where we represent over 8,000 frontline nurses and 60,000 frontline healthcare workers. Thank you to the Toronto York Region Labour Council for inviting me to share some words at your day of mourning ceremony. It truly is an honor and a privilege. This year, the Day of Mourning ceremony and the Day of Mourning is resonating with so many of us, as we know frontline healthcare workers are being put at risk each and every day by their employers and the government. We should not need to say this, but every worker who goes to work should return home in the same health in which they left. DSWs and PSWs should not need to beg for PPE. Nurses, RPNs should not need to beg their employers and the government to protect their residents, clients, and patients. We shouldn't need to say any of this, but unfortunately, because of a lack of proactive measures on behalf of the government, provincial government, and the employers, this isn't happening. Each and every day, frontline workers are being exposed. They're being infected, and some have died, and more will continue to die. From the very start of this pandemic, we have been demanding the government and all employers provide PPE based on the precautionary principle. This is the principle that we should not await scientific certainty until we take reasonable measures to prevent risk. Our immediate demands to government was that they provide PPE, that they increase testing for frontline workers, that they provide mandatory training in the donning and doffing of PPE, and that employers and the government provide transparency to workers so they know the level of risk in which they're entering when they go to work. We know that over 10% of the people of Ontario who have been infected are frontline healthcare workers. They are not being protected. SEIU nurses have been calling for the hierarchy in healthcare to be addressed systemically. Healthcare workers in every sector, in every work environment, should be provided with the same access to PPE. Directive number 5 initially only took into account RNs in the hospital sector. This excluded nurses up to 55% across our province. This was a direct attack on both unity within our profession and workers' rights to be protected. When frontline workers are not protected, neither are our families or our communities. SEIU is committed to standing shoulder to shoulder with all who want to see this change. To all the frontline workers, for everything that you do each and every day, thank you, and I pray for your protection each and every day. To all that have been injured or fallen ill, I pray for your speedy recovery. We will need you to join all of us and all of those who have lost a loved one, all of those who have lost a loved one to a workplace injury or illness. We are calling on you and your resilience and your deep connection to this issue to stand shoulder to shoulder with SEIU and our labor movement in Ontario. We will not sit down, we will not lay down, we will not take no for an answer until each and every frontline worker is provided protection and is respected. Thank you to the Toronto York Region Labour Council for having me today, and I pray for safety for each and every one of you who are out there each and every day. Thank you.
Let me first say thank you for having the opportunity to speak with you today. My name is Jack Oliveira, Business Manager of Local 183, which has almost 60,000 members, most of which work in the construction industry. This is a somber occasion where we recognize those who have died or were injured or were made ill in performance of their work and or while working on job sites throughout Canada. April 28, 2020 is a National Day of Mourning to recognize and reflect on the lives that have been lost or seriously injured, all while performing work so that they can advance their own interests and the interests of their families by providing labor in return for compensation for their employers. This is not a time for idle reflection. This is the time for a call to action for all unions, for all workers, for all government officials, for all contractors. Everyone needs to do more and ensure that workers are protected to the fullest extent of the law. In my view, if one person dies or is seriously hurt on the job site in the province of Ontario, it is one too many. Providing for yourself and your family should not mean risking your life in the process. For far too many workers in this daily occurrence, many workers in this province are forced to work outside of legal requirements, the requirements of the Occupational Health and Safety Act, and outside of the law. This is something that we regrettably see far too often on many construction sites and workplaces throughout the province where our members work. Local 183 members will never forget 5 Italian immigrants who all died on March 17, 1960 while working on a water main tunnel in the area of the Hogs Hollow near 401 and Yonge Street, which later became known as the Hogs Hollow disaster. These men, immigrants, and vulnerable workers, like many of our members, lost their lives in a tragic and senseless way. Their deaths were not in vain and sparked a public outcry that resulted in the fundamental rewriting of health and safety labor laws and requirements in this province. More recently, in 2008, more than 1,000 workers lost their lives while working in Canada. The number was only slightly less in 2017, when more than 900 employees lost their lives. This doesn't take into account the countless numbers who were seriously injured and maimed as a result of senseless workplace accidents. The time is now to mourn the lives of those lost on job sites and fatalities over the past year, and we must take the time to reflect and use that as a motivation for what appears to be a disturbing pattern of complacency which exists in this province and throughout this country. We must act together. We must lobby together. We must fight together to ensure that better and safer measures are put in place for all workers, including those vulnerable than others, to ensure as much as possible the health and safety of workers in this province and in this country. I want to acknowledge the hard work of all Local 183 members and retirees who have done a fantastic job of ensuring all the necessary precautions are and were taken on job sites to ensure the safety of all workers involved. Local 183 has lost 5 members over the last year in workplace fatalities, and countless others have been injured. These men will never be forgotten, and they are by name Christopher Panapinto, Christopher Lesko, Diogo Felipe Horta Botelho, Zygniew Gorski, and Ricardo Almeida. The family of these members who have died in the last year need to know that Local 183 will not rest, we will not go away, and we will not stop advocating for further and better safety precautions being incorporated into the laws of the province, and that any and all violators should be vigorously prosecuted to the fullest extent of the law to ensure that workers have a better and a safer place to work in the weeks, months, and years ahead. Thank you.
Hello there, brothers and sisters. I'm Mike Layton. I'm the City Councillor for University-Rosedale in the City of Toronto. Joining you today on this day of mourning when we think about those workers who have been killed and injured while doing their job. Right now, I think about all those families and those workers who are out there every day, keeping us safe, keeping us fed, getting us around our city, building the housing that we live in, bringing us the things that we need during these uncertain times. Now, I hope that their sacrifices and the risks they're taking are not made in vain, and that our city and our country continue to work to strengthen protections for workers and their families. I commit that to you. I look forward to working with you to see that happen. Thank you.
Today I stand in solidarity with workers across Ontario and Canada in marking the National Day of Mourning. During the COVID-19 pandemic, we are especially thankful for essential workers, healthcare workers and public health staff, first responders, pharmacists, grocery store staff, farmers, truckers, supply chain workers. And we're especially sorrowful for those of them who have been infected by COVID-19 at work. We mourn the loss of people who have died from this terrible virus, and remember that even during this extremely challenging time, every workplace death is a preventable death, and every worker has the right to protection and safety at work. No exceptions. On this day of mourning, I'm launching the fight to ensure that all workers during this pandemic have presumptive coverage for COVID-19, both for the virus itself and for the trauma, PTSD, and mental health challenges that may come after it. As we mark the National Day of Mourning, we remember the dead and fight for the living.
Hi, I'm Marit Stiles, the MPP for Davenport. On this day of mourning, let's remember that while we mourn the dead, we fight for the living and the right of every single worker to return home safely every single night, especially in this moment.
I'm Jill Andrew, MPP for Toronto St. Paul's. On this day of mourning, let us please remember that workers have a right to come home after a day or night of work safely. And our unions, thank you for helping to keep our workers safe.
Hi, I'm Rima Burns-McGowan, MPP Beaches, East York. Every worker has the right to return safely to their family after a day or night of work. We need to keep everyone safe. Mourn the dead. Fight for the living.
I'm Jessica Bell, MPP for University-Rosedale. On this day of mourning, I'd like to recognise our frontline workers, from our TTC employees to our respiratory technicians to our office cleaners. Your lives matter, your health matters. On this day of mourning, let's mourn for the dead and fight for the living.
Thousands of our workers have been killed or injured at unsafe workplaces. Many of them, especially those who risk their lives to save us, have become victims of poor legislations and corporate greed. On this day, we strengthen our commitment to health, safety, and protection for all our workers. On this day, we mourn for the dead and continue our fight for the living.
I'm Tom Rakosovic, MPP for Humber River Black Creek. Many workers today have rights, benefits, and a decent salary because of the sacrifices made by generations of workers of the past. We must mourn the dead, and we must continue the fight for the living.
I'm Peter Tabbins. I'm the MPP for Toronto Danforth. It's very clear in this pandemic that workers need unions if they're going to protect their safety, if they're going to protect their lives. Let's mourn the dead. Let's fight for the living.
Hi, I'm Chris Glover. I'm the MPP for Spadina Fort York. It's so important that we take this time to mourn those who have given their lives during this pandemic to save the rest of us. And it's also important that we send our thoughts and prayers to those frontline workers who have contracted COVID-19 and are now fighting for their lives in ICUs and hospitals and at home across the province. Mourn the dead, fight for the living.
My name is Faisal Hassan and I'm your Member Provincial Parliament for York South Western. A day of mourning is a day where we mourn the dead and fight for the living, to fight together for the rights of workers.
My name is Suze Morrison and I'm the MPP for Toronto Centre. Today we mourn the dead and fight for the living, and more than ever give thanks to all of the frontline and essential workers keeping our communities safe right now. Thank you.
Greetings, my name is Janet Patterson and I am the president of the Ontario Network of Injured Worker Groups. Each year on April 28th, we gather to remember workers who have been killed, made ill, or suffered a workplace injury, and to once again commit to continuing the fight to protect all workers with safe and healthy workplaces. COVID-19 has forced us to change the way we remember this day, but more importantly, we also recognize the many essential workers who are facing both challenges and dangers that they will hopefully never have to face again. In 2018, 2021, 1,027 workers across Canada died while at work, an 8% increase from 2017. We have no way of knowing what our losses will be this year. Essential workers, normally listed as emergency responders and healthcare workers, have increased to include drivers, shippers, grocers, and workers from pharmacies, corner stores, liquor stores, coffee shops, and many others. While it is hard to believe that many in the healthcare services have been forced to work without proper PPEs, we now have a large workforce of other essential workers who are doing frontline work and could unknowingly be dealing with someone who's asymptomatic from COVID-19 and have no PPEs available to them. We need to make sure that every frontline worker has the proper protection and training they need to ensure their safety. The workers' compensation in New Jersey has now passed a law that provides workers' compensation to any frontline worker who has come in contact with COVID-19. We need the Workplace Safety and Insurance Board here in Ontario to step up and forget about the case-by-case adjudication previously announced by them. All frontline workers who are facing this deadly virus to provide essential services to Ontarians should be assured that they will immediately be provided with all the benefits and supports that they need should they contact COVID-19. COVID-19 has also raised additional challenges for many vulnerable injured workers who are either active in a compensation program or who have been deemed by the WSIB and are facing poverty. Staying safe and living in poverty do not work well together. Loss of earnings must be available to all injured workers whose WSIB programs have been affected by COVID-19, as well as for those who have been deemed, as we know that there is no available work for any injured workers. We need our government to remind the WSIB that their mandate is to take care of workers injured in their workplace, and there are thousands counting on them. We cannot gather together on April 28th in body, but we certainly can in spirit. Together, we rededicate our commitment to continue to fight for the right of every worker to have a safe and healthy workplace. And for those who have suffered permanent injuries, we continue to fight for a fair and just compensation system. Thank you to every worker who goes to work during this pandemic, providing us with all we need so we can stay safe in our homes. The COVID-19 pandemic will never be forgotten, and all of you will be forever remembered for your dedication. To everyone, be safe.
Hello, my name is Carmine Fiore. I'm the Chief of Health and Safety for Local 416. First and foremost, I want to thank our family that are out there, currently in the workplace, providing essential and critical services to our public and our residents of our great city. I also want to thank our frontline healthcare workers that provide the necessary care to our public through this challenging time of COVID-19. I also want to point out the importance of social personal distancing and the importance of frequent washing of hands. I am very confident that we are going to get through this tough time together if these measures are being taken. As this year's National Day of Mourning approaches April 28th, we are faced with an unprecedented pandemic. Our workplace needs assurances from employers that workers are safe and proper PPE are provided. I would like to acknowledge all workers who have been injured in their workplace or have lost their lives in the workplace, especially our very own brother Curtis Smith. As you may or may not be aware, we recently lost one of our solid waste members in a tragic accident the morning of May 29th. 27-year-old Curtis Smith went to work, as he did every day, to serve the citizens of Toronto with one wish: to return home safely to his expected partner. He was sadly unable to do so, and we are less for his loss. Curtis fought survival but succumbed to his injuries for 1 week later on his 28th birthday. This, no doubt, is a terrible tragedy, which we certainly grieve. Beyond that, however, we need to rejuvenate our zeal to improve the health and safety of our brothers and sisters. From our family at Toronto Civic Employees Local 416 to yours, we would like to remember all the workers that did not make it home to their families and loved ones. I can't stress enough, be safe out there through this trying time. In solidarity, Carmine Fiore, Chief Health and Safety, Local 416.
My name is Veronica Zaragoza. I have been cleaning for almost 10 years. I have worked cleaning in factories, in stores, malls, condominiums, houses, everywhere. In many places, they didn't pay me a minimum wage, vacations, overtime, sick days. They didn't provide me also health and safety equipment or any training. Nothing. I'm working for Worker Action Center as an organizer. I'm part of the 15 Unfairness campaign. I organize cleaning sector and people with precarious job. And today is a good day to remember Enrico Miranda. Enrico Miranda was the 5th temp agency worker who died at the Fiore Foods company because the Ontario government failed to protect temp agency workers. Corporations and companies don't want to spend money on workers. We need the companies to be fully responsible for the health and safety of the temp agency workers they hire. Right now, during COVID-19, the workers who are doing some of the riskiest jobs are the with the less protections. For example, workers in a grocery stores, care workers, health providers, or cleaners. As an organizer, every day I have received a lot of calls for the cleaners, telling me the employee doesn't provide masks or plastic gloves. They are using a really dangerous and risky chemicals. They don't have options to refuse the work because they don't have sick days. They are still working and they are dying. In fact, the first health worker who died in Ontario was a cleaner from Brampton Hospital. The government knows, but they ignore us. Who are the next? We need protections for our workers. We need regulations for temporal agencies. We need paid sick days. We need safety and equipment for workers. We need to increase the minimum wage. We need justice for Enrico Miranda, and we need justice for our workers.
Hello everyone, my name is Dave Mitchell. I'm the president of CUPE Local 79. I have the great privilege of representing over 23,000 CUPE Local 79 members at the City of Toronto, Toronto Community Housing, and Bridgepoint Hospital. As public sector professionals, we work to make Toronto a great place to live. That includes working on the front lines to support Toronto's most vulnerable communities. For years now, we've been fighting cuts that have undermined the ability to respond to the needs of these communities. Understaffing in long-term care, shelters, housing, public health, and social services have made the system more fragile than it's been in a very long time. The COVID-19 pandemic shows the terrible consequences of that fragility. Our members are struggling right now to stop the spread of COVID-19 in Toronto, but with limited resources, it's been an uphill battle. Many of our members have been infected with COVID-19 while doing their work. The stress and illness these frontline workers are facing will have lasting repercussions. On this day of mourning, please join me in thinking of them. When this pandemic is over, we will have to redouble our efforts to ensure that a system failure like this never happens again. Thank you.
Hello, my name is Catherine Hoy, and I'm the Provincial First Vice President of the Ontario Nurses Association, referred to as ONA. I am also a registered nurse. ONA represents more than 68,000 registered nurses and healthcare professionals, as well as more than 18,000 nursing student affiliates, providing care in hospitals, long-term care facilities, public health, the community, clinics, and industry. The National Day of Mourning hits very close to home for ONA. We remember registered nurses and ONA members Nelia La Rosa and Tekla Lynn, who died after contacting SARS while caring for infected patients. We remember registered nurse and member Lori DuPont, who was murdered while working at the Windsor Hospital. We cannot forget that healthcare workers continue to have some of the highest rates of injury and illness statistics in the workforce. This year, the National Day of Mourning is even more meaningful. It would be an enormous understatement to say these are very challenging and stressful days for our members. They are on the front lines in hospitals, long-term care homes, in the community, battling a terrifying virus that the world still knows little about. They are selflessly providing expert care to their patients, residents, and clients around the clock, while the number of COVID-19 cases continues to soar around them. They are also exhausted and terrified. Terrified they don't have the proper protective equipment that they need to stay safe so they can continue to provide care throughout this pandemic. Terrified of bringing this deadly virus home to their families. Terrified that they might not come home at all. Tragically, we already know that many of them have been infected by COVID-19. Even more tragic, it didn't have to be this way. The need to appropriately fund our healthcare system and value the work these dedicated nurses and healthcare professionals provide on the front lines was evident during SARS. We seem to have forgotten the #1 recommendation from Justice Campbell's SARS Commission report, the need to apply the precautionary principle or erring on the side of caution when scientific knowledge is lacking. For ONA, this means that workers who are at risk of exposure must be equipped, trained, and drilled to use the appropriate personal protective equipment. We have had some success this far, but we will not stop fighting until every nurse, healthcare professional screening or treating suspected or confirmed COVID-19 patients in all healthcare sectors have access to the proper personal protective equipment. After all, if they're not safe, their patients, residents, and clients are not safe. So on this National Day of Mourning, as we remember those lost, made sick, and injured on the job, I ask that you please take a moment to also think about the nurses and healthcare professionals on the front lines fighting this pandemic for us. We owe them. We owe them our deepest respect and our gratitude. Thank you to everyone, and be safe.
Hi, I'm Tom Parkin, Managing Director of the Workers' Health and Safety Center. Today, our day of mourning, workplace COVID-19 exposures are killing workers and making many very sick. The Occupational Health and Safety Act says employers must take every reasonable precaution for the protection of workers, but in many workplaces that's not happening. The SARS inquiry's recommendations aren't always being followed. Government isn't always being transparent about how they're enforcing protections. You can get a $1,000 fine for standing too close to someone in a park, but if your employer says to do it in the workplace, there's no penalty. The Workers' Health and Safety Center was created to provide the highest quality training. We can't run training classrooms right now, so we've adapted. Every week we're producing 2 or 3 30-minute webinars. You can watch past webinars on our YouTube channel. And they're there about cleaning and disinfecting, using your right to refuse, and applying the precautionary principle. And every day, for a couple weeks now, we've been running virtual classrooms, connecting instructors to workers just as we always do, with all the interactivity, still face-to-face with the buzz groups and the worksheets. And next week, we launch a really important new half-day virtual course, The Hazards of COVID-19. We'll discuss the characteristics of COVID-19 and review public and occupational law. And importantly, this course will help workers see how to apply distancing, cleaning and disinfecting, personal protective equipment, and other important life-saving controls to prevent COVID exposures. The need for worker protection against COVID isn't ending soon. Every workplace needs a COVID control plan for essential workers now and for all other workers as people start to be asked to go back to work. Please use our training and information to push for that control plan that protects you from COVID. In our proudest moments, we've done so much to make workplaces safer and healthier. Today, let's work closely together again to prevent more COVID exposures and to keep this virus from hurting more workers and all of us. Thanks.
Hello, I'm Merv King, the coordinator of the United Steelworkers Injured Workers Program. April 28th is the most solemn day on any union calendar. Each year, we remember the men and women who lost their lives in workplace accidents or from occupational diseases. We are now fighting a war on a global scale against a deadly virus, COVID-19. April 28th, we mourn the many frontline workers, doctors, nurses, healthcare workers, and those deemed essential workers who sacrificed their lives fighting this pandemic. Our union has a history of fighting to have diseases be included as compensable under the Workplace Safety Insurance Act. Protection of lives should be the #1 concern of all of us. Nothing can replace a loved one. Mourn for the dead, fight for the living. Solidarity. Thank you very much.